Good morning, everyone. We are so happy to be here with you. We're not particularly happy about the topic that we're here to discuss, our mental health crisis, but I am extraordinarily grateful to be here with these three. In my work as a journalist, I've had the privilege of interviewing literally hundreds of researchers and clinicians, and I haven't encountered three who are more thoughtful or insightful than Sarah, Laura, and Matt. Matt, I'd like to start with just a really big picture view. We've been hearing about the mental health crisis for so long now that I think some of us lost sight of what it actually is and how we know that it is happening. You even hear some people say, well, some of what we're seeing is really just decreasing stigma, increasing reporting. So can you tell me, both in terms of the data and in terms of what you're seeing in your life as a psychiatrist at Georgetown, what we're looking at?
Sure, Kate. So if we walked out of here and transported back to DC and walked into the emergency room at our University Medical Center, or really at any large hospital around the country that I'm aware of, we would find 2 or 3 young people on beds in the hallway, waiting for admission to a psychiatric unit, sometimes waiting hours, many times waiting days, sometimes waiting weeks, because there's not enough services available.
When you were a medical student, was that the case?
It was not. It was not the case. And there are a lot of reasons for that. There's reasons that have to do with this crisis that we're going to be talking about today, and there's reasons that have to do with the way that we have constructed and deconstructed services in this country, in our health systems. But I think there's several factors that would help me to understand that crisis and what that means. I think the first factor is that there's unquestionably an increase in really severe symptomatology, really severe suffering in kids with severe depression, kids with crippling anxiety, eating disorders, addiction, suicidal thoughts and suicidal behaviors that went up really significantly during the pandemic and continues to be really elevated. And it is obviously very distressing and speaks to the inadequacy of our systems to meet those needs right now. But then I think there's a second tier to this, which is actually a much larger tier, which is the degree to which young people in our country are experiencing everyday distress. There's a lot more everyday loneliness, isolation, sadness, disconnection that is not at the level of a psychiatric crisis, but it certainly describes an experience of a dearth of well-being among young people in our country that I think you'd be hard-pressed to talk to anyone these days who doesn't know a young person who that would describe. So that's going on as well, and that actually long predates the pandemic and just actually continued at pace during the pandemic, continues now. I think the third factor, you alluded to stigma. There's no question that stigma is rapidly declining. There's no question, as was mentioned in a panel earlier this morning, that the kids are leading the way and demonstrating enormous bravery and courage in helping us understand how to talk about our emotional experiences. And I think the decline in stigma is actually helping to reveal the fact that what many of us know, which is that mental health problems are not rare. They're actually part of the human condition. They're part of every family. And we're seeing it more clearly now than we did before. And then I think the fourth thing to consider is that I would consider this youth mental health crisis, which is the phrase that's most often used, is actually a family crisis. It is a crisis of families who are overwhelmed, families who do not have the resources, financial, cognitive bandwidth, stress tolerance to deal with what it is to be raising a kid in this decade, in this country, at this moment in history. It's extraordinarily challenging and overwhelming for families, and we see the impact at the level of kids who are suffering.
As a parent, that certainly sounds right to me, and if I'm struggling this much as the parent of a 14-year-old and a 10-year-old with the resources I have, I can't even fathom what it looks like for most people in this country. Laura, your organization, the Judd Foundation, put out a report recently on youth suicide, which is one of the best things that I've seen recently on the youth mental health crisis, and I really urge everybody to read it. It comes up with a list of sort of 7 broad factors, which are overlapping with some of the things that Matt has just mentioned. But I was wondering if you could say just a bit more about a couple of the ones that you think are especially key.
Yeah, thank you. And I wanted to say, actually, I share a lot of the concerns that Dr. Biel has, and I'm seeing the same thing in my practice. So, I work in psychiatric emergency rooms, and then I also work at an LGBTQ youth clinic, and I'm seeing what you're seeing in the emergency room. So, there are kids that are sitting there, and they're sitting there without anything. They don't have their phones on them, they don't have people they love around them, and they're in hospital gowns, and they're sitting there for a week at a time waiting for inpatient units. And then in my practice at the LGBTQ Youth Center, which is Hetrick Martin Institute in New York City, I see young people, and what I'm most worried about is their anxiety levels. I mean, they're just through the roof. They're not able to do things like pick up the phone and call to order a pizza, leave their houses. So I'm really worried, and I think that I really appreciate you saying that about the Suicide Trends Report, which is what we're calling it. We basically go through what's been going on the last decade for young people in terms of suicide trends and in terms of mental health. And the kinds of things that we're seeing, I think a lot of them are tied to a moment in time. And I think that moment in time is around, let's say, 2010, 2012, with the introduction of smartphones. And this is really, it's not a phone, right? It's a computer in your pocket. And that really changes everything. It changes the way young people are living, and they're living in a different world now than we're living in. So, that leads to things like loneliness. If we look at loneliness, a lot of people talk about, that changed during the pandemic. Actually, if you look, we saw that time spent in person with friends had dropped by half from 2003 to 2019 before the pandemic even began. So
Among children.
Right, among youth,
Among youth.
15 to 24.
Wow.
So you're seeing already trends before, and then in 2020, it had dropped by 70%. So there's an additional 20% drop during the pandemic, but this was already happening. And you were seeing suicide rates increasing during that time. That didn't start with the pandemic, that's been going on. And it's this change, right? And it's not necessarily a bad change. This is technology. This is the water we swim in. It's the world we all live in, everyone in this room. But it has ripple effects, and we have to think about how it's affecting young people. It means that they're seeing things constantly in their news feed. So young people are seeing, racial violence hitting them in their news feed. They're being bullied in school, but now they're also being bullied online. And there are lots of really good things about technology, right? We can connect young people. I work with LGBTQ young people. If they're in rural areas where they, don't have access to young people around them who are like them or supportive adults, now they can reach those people online. But we have to think about what are all of the ripple effects and how do we make sure that we're keeping young people safe?
I think that's a really good lead into something I was hoping to ask you about, Sarah, which is the curious fact that while this crisis affects pretty much, if not every demographic group of youth, across the country, rural, urban, by state, by gender, by sexual orientation, by racial and ethnic group, there are definitely some groups that are suffering more and are seeing much steeper increases in suffering. And so I was hoping that you could talk to us a little bit about that with an eye to what that reveals, what the underlying structural and other causes of those differences might be.
Absolutely, and thank you for that question. I have practiced child psychiatry in an affluent part of Atlanta and a poor part of Atlanta throughout my career. And so from Monday to Tuesday, there's this juxtaposition of what it means when you have resources and what it means when you don't for the same DSM condition, right? So we a lot of times focus on symptoms and diagnosis, but the reality is when it comes to what I can offer children, what their parents are able to do for them, what the stressors that are contributing to that diagnostic picture are, they're very different. And they're based on societal hierarchies. They're based on the distribution of opportunities and resources. And frankly, it has a whole lot less to do with the healthcare system than we would like to believe. When it comes to children's mental health, by the time they get to folks like us, often it's a tertiary care situation, and there have been problems for a long time, right? Most of what makes them sick, most of what makes them ill, most of what helps them get better really is external to the things that we traditionally do in our systems. And it's one of those things that we are getting a little bit better about understanding in medicine and the mental health field, but we still have a very individualistic focus when we're trying to understand the person in front of us, and it's still very disease and pathology driven. So when we discuss social determinants of health, by the time they come to us, they've already been exposed to that risk factor. That's increased their risk of having symptoms, of having a diagnosis. But the step back, right, is to think about the social determinants of those social determinants. And that ultimately is an issue of social justice, because then we're thinking about the opportunity of resources. We're thinking about how we distribute the money that we have, and the choices that we're not making to do things that we know would actually promote health in youth.
Could you, not to put you on the spot, but could you help bring that alive in terms of like a sort of hypothetical or amalgam contrast between one of your Monday, Tuesday patients and one of your later in the week patients? Like how might the person with fewer resources be situated?
So let's take school stress, for example, right? You know, I'm the therapist. You can come talk to me about how stressful school is, and I can try to give you coping mechanisms. It's another thing if your parent can sue the school and get the resources you need so you're not stressed at the school and you're actually learning at the place where you're supposed to be learning. That's a whole lot better than talking to me about it, right? So families with resources can do that in a way that it takes months, sometimes years, for us to get that for kids in the public sector school system whose parents don't have those resources.
It's a great but tragic example. Matt, I wanted to circle back to something you alluded to and to something that you alluded to, Laura, which is the role of social media. I mean, we could talk about that all day, but could you just give me, again, a very high-level view of how the thinking on that's changed? I think that we're in a very different place than we were 5 years ago, and what you see as the really key things to understand.
Sure. So we've decided to conduct an enormous experiment on our children, right, over the last 15 years. And we're learning very rapidly about what that experiment means. And what's I think is indisputable at this point is that phones have changed childhood in a profound way, have changed the experiences of childhood and parenting in ways that are almost unprecedented historically, at least in this sort of industrial and post-industrial era. The change in childhood over the last 15 years is exceptional. The second thing that's overwhelmingly clear is that phone use displaces other activities for young people. So time spent on social media, whatever the content is, whatever the value or lack of value is, it is taking the place of something else. It is oftentimes taking the place of in-person interactions. It is taking the place of unstructured interactions with peers. In particular, it has taken the place of boredom and creativity and daydreaming, and it has taken the place of sleep. And so none of those things are good for our mental health. That is not a reach to say that. I think other things to think about with regard to social media is that not all kinds of use are the same. And so being on a messaging app for 5 or 10 minutes and connecting with friends is probably, in 2024, an adaptive social behavior for a young person in many cases. It actually does increase social connection. And being on a different kind of social media application for 30 or 40 or 80 or 200 minutes, passively looking at material, is almost certainly not salubrious around our mental health. And when I'm in schools, I talk to kids about all that time. Like, notice the difference between 5 minutes of messaging and 40 minutes of scrolling through videos and how you feel before and afterwards. Keep track of it. And that's one of the few cases that kids don't push back on with regard to their social media use. They acknowledge that very readily, that it usually makes them feel lousy. Another aspect, sorry to interrupt, another aspect is just think it's not all the same for all kids. Younger teens as opposed to older teens and young adults, it's a different level of risk. It's certainly worse for younger teens. Kids who have pre-existing emotional vulnerability, whether that's anxiety or depression or neurodevelopmental differences, are almost certainly more vulnerable to the pernicious effects of social media use. And kids who are prone to social comparison, which in general tends to be girls more than boys, although that's a gross oversimplification, but it is a social comparison machine like nothing else that's ever existed, and it really makes kids feel lousy. And I guess the last point I make is that we invented this thing, right? Like, people right out these windows invented this thing. We can make it better too, right? Isn't that still in play?
Yeah, absolutely. In our remaining time, I'd love to do a lightning round that's focused on that idea of making it better. So maybe, Sarah, could you kick us off by letting us know about anything that you think is working, anything you're seeing that you think is really promising or that represents progress, and maybe one big blue sky dream. If you were sort of czar of mental health for this country, what would you do?
So if I was czar of mental health for the country, I would really push to expand how people think about mental health and mental health policy, right? Housing policy, hunger policy, school education policy and funding, paid time off for parents. Like, all of those things are youth mental health policies. And when we start with Medicaid and treatment and diagnoses and symptoms and illness, we've missed the boat. And so really thinking about mental health more broadly, there's mental health in all policies. And what I see that I think is helping, and what I hope to see more of, and that I think we can all do in the capacities that we hold, is extending our power, our platforms to youth voices. So looking for ways to incorporate their perspectives, because 14 for them is a whole lot different than 14 was for us. And as we try to come up with solutions, we are missing things that are really important that we don't even know to ask about or look for without giving them space and time.
That point is so critical. I mean, to your point, Matt, I really think this is the biggest and most meaningful generation gap that's probably ever existed between parents and children. I've put that question to historians of childhood, and nobody disagrees so far. But didn't want to interrupt you.
That's it.
Laura, can I ask the same of you? What's working, and what would you love to implement if you had a magic wand?
Yeah, I mean, absolutely. So I would say, I don't know how many people in the room have played that game Whack-A-Mole, where you go like this, That's what we're doing right now, right? We're like, oh, over here, this is popping up. Bam, let's try and hit that. Let's try and get this. What's going on over here, right? We need a clear plan and a clear strategy, right? So that, I mean, we talk about that at the JED Foundation. We have a comprehensive approach that we use with every school that we work with. We go through every domain. What are you doing here? What are you doing there? The National Governors Association has a playbook for each of the states. What can you do regarding youth mental health? What are all the steps? We have a national strategy for suicide prevention, and there's a new version of it coming out this coming month. We need to think broadly, right? And we need to think through each of the steps. So Sarah's absolutely right. Like, we need to start with what's going on with people's basic needs and getting what they need to survive and to thrive, right? We know that increasing the minimum wage decreases suicide rates on a population level, those kinds of things, right? We need to make sure young people are connected to community, that they have people around them who support them, that they are connected to their peers, that they're learning the social skills that they need to learn, right? That may mean social emotional learning, that may mean digital literacy, young people getting a choice about what they're doing online. And then, of course, we have to come back to treatment, right? There are going to be some young people in whatever system we're in that are going to need treatment, and we're going to need to make sure they're able to get that treatment in schools, that school-based mental health is paid for through insurance, that we have parity that's actually being carried out. So every step of that process, but making sure we have a real plan.
Matt, to you for a last dream ask.
So child tax credit, paid family leave, and affordable child care are mental health interventions for families. So we have to think about them that way. Adequate mental health services in schools for children, for their parents, and for their teachers. Multi-generational, comprehensive, holistic mental health care in schools. I think community health workers as the extension of the mental health workforce, to include people with lived experience who live in communities, who know their communities and what they need. And I'm voting for Sarah and Laura for czar, but if I ended up as czar, it picks up on something that Jonathan said, one of the youth on the panel this morning, which has to do with this divide. If I were czar, there'd be a service year for every 18-year-old in the United States. There was a non-academic service year, so that people could work across differences together on important things for our country, because there is so much to build, and it's a missing experience for our young people.
I love that. Thank you, all three of you, so much for joining us.